The night shift at Memorial Hospital's ICU buzzed with the quiet intensity that only healthcare workers truly understand. Rachel Martinez adjusted her scrubs and checked her patient assignments, her tired eyes brightening as she read the names. After 12 years of nursing, she still approached each shift with the same compassion that had first drawn her to healthcare. Room 412 held Robert Wilson, a 72-year-old patient recovering from complicated heart surgery. His family had been keeping vigil for 3 days, their faces showing the strain that only ICU families know. His daughter Sarah sat closest to the bed, trying to understand the maze of tubes and monitors surrounding her father. Rachel noticed the confusion and worry in Sarah's eyes. Instead of rushing through her routine checks, she pulled up a chair beside her. "Would you like me to explain what each of these things does?" Sarah nodded gratefully. Rachel took out a piece of paper and began drawing simple diagrams. "Think of these lines like roads in a city," she explained, sketching as she spoke. "This one brings medicine to help his heart beat stronger. This one helps him breathe easier. And this one tells us how well his heart is working." What Rachel didn't know was that Robert, despite appearing to sleep, was keenly aware of everything happening around him. As the former director of the Wilson Healthcare Foundation, he'd spent decades evaluating how medical staff interacted with patients and families. His foundation had funded numerous hospitals, always emphasizing the importance of compassionate care. Throughout the night, Rachel went above and beyond her duties. She brought warm blankets without being asked, helped Sarah contact distant relatives, and even remembered how Robert liked his ice chips crushed extra fine, a detail Sarah had mentioned only once in passing. During her breaks, instead of retreating to the break room, Rachel would sit with the family, sharing stories about her own journey into nursing. She told them about her grandmother's battle with cancer and how the kindness of one particular nurse had inspired her career choice. "That nurse didn't just take care of my grandmother," Rachel explained, adjusting Robert's blanket. "She took care of our whole family. She taught me that healing isn't just about medicine. It's about treating the whole family with compassion." As dawn approached, Sarah finally dozed off in her chair. Rachel quietly covered her with a warm blanket, just as she had done for countless other family members over the years. 3 days later, Robert's condition improved significantly. As Rachel helped him sit up for the first time, he spoke more than he had since admission. "You remind me of someone," he said softly. "Oh? Who's that?" Rachel asked, adjusting his pillows. "A nurse who cared for my wife during her final days," he replied. "She showed the same kindness you do, treating us like family, rather than just another case." Over the next week, Robert continued to improve, and Rachel continued her attentive care. She taught Sarah how to help her father with simple exercises, showed her how to read the monitors, and always took time to answer questions, no matter how busy she was. What Rachel didn't realize was that Robert and his family were making plans of their own. As director of the Wilson Healthcare Foundation, he had the power to make significant changes in healthcare education and delivery. The day before Robert's discharge, his son James, the current foundation director, arrived with a leather portfolio. "Rachel, could we speak with you for a moment?" Rachel sat down, wondering if something was wrong. Instead, Robert began to speak. "For 30 years, I've worked to improve healthcare through our foundation," he said. "We've built wings, bought equipment, funded research. But watching you this past week reminded me of something crucial. The human touch in healthcare can't be bought. It has to be nurtured." James opened the portfolio. "We're establishing a new program," he explained. "The Rachel Martinez Nursing Fellowship. It will provide full scholarships to nursing students who demonstrate exceptional compassion, plus funding for hospitals to create family support programs." Rachel's hands trembled as she read the proposal. The fellowship would help dozens of aspiring nurses each year, plus create comfortable family areas in ICUs across the country. "But why me?" she whispered. "Because you showed us what healthcare should be," Sarah answered. "You didn't just care for Dad. You cared for all of us. You made a terrifying experience bearable with your kindness. The fellowship launched 6 months later. Rachel helped select the first class of scholars, choosing candidates who showed the same compassion she'd learned from that long-ago nurse who'd cared for her grandmother. Today, the Rachel Martinez Fellowship has helped hundreds of nurses complete their education. Each hospital that receives foundation funding must create a family support program, ensuring that no family faces the ICU journey alone. In Rachel's office hangs a simple photo, her grandmother's nurse from years ago, smiling beside a hospital bed. Below it sits her favorite quote: "In healthcare, kindness is as important as knowledge." Because sometimes the smallest acts of compassion create the biggest changes. Sometimes a simple explanation drawn on paper can lead to helping countless families. And sometimes, when we treat others like family, we end up creating a legacy that helps generations to come. If this story touched your heart, remember to subscribe to Moments That Matter for more stories that remind us how compassion can change lives. Because every moment matters, and every act of kindness has the power to transform not just one life, but countless others. Remember, in healthcare and in life, it's not just what we do, but how we do it that makes the difference. True healing begins with the heart.